Last week, health experts urged the province to tighten the lockdown and the types of businesses that could remain open. The government opted for other actions instead. But this week, first in Peel and then in Toronto, the medical officers of health decided to take action. Dr. Lawrence Lowe is Peel Region's Medical Officer of Health, and he joins us now from North Toronto. And Dr. Lowe, it's good to see you again. How are you managing these days?
Well, I think we're in the midst of a really dire time, obviously, in the region of Peel, but hopefully we'll get through it soon.
Well, let's pick up there. The World Health Organization says that when all the testing is said and done, the positivity rate of 5% is really the ceiling we ought to be looking at. The rates hit more than 22% in Brampton, which of course is part of Peel Region, this past week. I'm not a doctor, but is that as appalling as it sounds?
Steve, it is extremely concerning, and certainly the 22% test positivity in Brampton, but the double-digit test positivity throughout all of our three municipalities and on an average in Peel really show that the variants are gripping the community tightly, both in respect of the cases that are now, being seen at levels that we haven't seen since the start of the pandemic, and translating into what is a frank crisis in our hospital systems at this time.
Obvious question, but let's ask it. Why is this happening?
Well, I think it's really driven by the variants to a large degree, and also by the ongoing contact and interaction that's occurring in the region of Peel. We heard from the science table that the variants are more transmissible, and in order for us to keep them under control, especially as we try to vaccinate our way out of this, we need to make sure that our reproductive number, the infamous R factor that people speak to, needs to be below zero point 0.7, which it never has been throughout the region of Peel. And a lot of that is just driven by the nature of our community. We're a very populous, dense urban community in Southern Ontario, in the Greater Toronto Area. And we also are the manufacturing, distributing, and production hub for the Western GTA, which means lots of essential workers, lots of interactions in workplaces, and essentially a continued risk of transmission of these more transmissible and more severe variants with each passing day.
Yeah, I wanted to dive down a little bit more on that word interactions. We understand that there are some dense workplaces, but we're 14, 15 months into this thing. Surely everybody knows by now about physical distancing, washing hands, wearing masks. If that's the case, why are there still so many positive test results?
Well, that's actually the biggest challenge that we face, Steve, is while we can do all the precautions, to the extent that the precautions are not foolproof, the variants, if they find a way in, or if there's even a slight lapse, they are really latching and taking hold. And then what happens is we see transmission in those large essential workplaces in our community, and then people tend to take it home to their household, and then from there out back into the community again in other workplaces. I think the analogy that I use is it's kind of like driving a vehicle. You can have seatbelts and airbags and a clean windshield, but if you're driving at 300 kilometers an hour, those measures become a little bit less effective in keeping you safe.
Understood. All right, let's talk, if we can, about about the events of the last 5 or 6 days or so, because they have been rather extraordinary in the province of Ontario. We, of course, saw last Friday the government of Ontario, the premier in particular, make his announcement in the afternoon at Queen's Park, where there were a whole bunch of new rules put in place. The outdoor gatherings were banned, playgrounds closed, police enhanced enhanced powers to give people $750 citations, ask them, why aren't you at home, this kind of thing. And extraordinarily, the police said, thanks, but we don't want these powers. The province backtracked a bit. What do you think of the status of where things are now?
Well, I think to the degree that some of the measures, the stay-at-home order and the strict measures are in place, one of our big challenges is that we do continue to track mobility in our community, and we do continue to identify where there may be transmission occurring. Certainly, it continues to occur in our essential workplaces. It does continue to occur in close contact situations, and so I think to the extent that we have a provincial stay-at-home order, but the streets out there are still incredibly busy. I mean, even just coming back from work yesterday, and I actually stick to my own advice. I usually try to work from home as much as possible, but the mayors do appreciate it when I show up in person for for our press conferences, of course. But the point being that even when I was driving home, I actually hit traffic. So that really suggests that there's a lot of people out there, and that means that there's a lot of contact interaction that is still occurring in our community.
which perhaps led you to the decision that you took and the medical officer of health of Toronto took as well, to start using so-called Section 22 orders to get businesses that are particularly vulnerable to COVID-19 to close down. First of all, an obvious question. I don't want to assume everybody knows what this refers to, but Section 22 of what and what are you doing?
So, Section 22 of the Health Protection and Promotion Act provides for local medical officers of health to direct an individual or a class of individuals to take certain actions to immediately reduce a communicable disease threat. Certainly, we've had a number of Section 22 orders issued in the region of Peel, and certainly we've actually worked on a lot of them with our colleagues in the City of Toronto because they have many similar challenges with their population and their transmission patterns in their community. We did work with Toronto on this one as well, and I think it really was just a recognition that in workplaces, the workplaces that have remained open are essentially where we are now seeing a lot of spread. In our region, 5% of cases are acquired at the workplace, and that really speaks to not just the acquisition of the workplace, but the potential transmission there too in individuals' homes, etc. Which is why we took this action under Section 22 to really address what we see as an ongoing challenge in some of the workplaces that remain open in our communities.
And just humor me on the plumbing of all this. You can take this decision yourself. You don't need the province. You don't need Peel Regional Council to endorse it. You did it.
So, in essence, we are given this legal mandate and obligation to the extent that if we identify a communicable disease threat in our community that needs to be addressed through directed action, that the provincial act actually provides for us to have that power. Certainly, there is an opportunity for people if they are directed to do so under Section 22. There is an opportunity for those individuals to appeal within 15 days of the order being passed, and that those would be heard by the Health Service and Appeal and Review Board. But I think to the extent, obviously, that I try to keep my regional council as my board of health apprised of what's happening, and also our chief medical officer of health at the province. Ultimately, the act is very clear that if a medical officer of health deems that there is a communicable disease threat that needs to be addressed through a Section 22, that power is available to them.
All right, but as we saw last weekend, it's all well and good for authorities to make decisions, but if the governed don't go along with it, and clearly last weekend those who are governed, as opposed to those making the decisions, they were not on side. You can make that decision, but how do you enforce it?
So, the enforcement of the powers of the Health Protection and Promotion Act are typically enforced by public health inspectors. However, as you can imagine, most of our public health inspectors have been in this marathon of a response for quite some time. And in fact, the province has actually provided within the Reopening of Ontario Act that any peace officer can enforce the provisions of the Health Protection and Promotion Act. When you get to the nuts and bolts of it, though, I think we're really trying to send a strong message to employers and to our community that we're in a very serious situation here. Hospitals are overcrowded, ICUs are overflowing, patients are being transferred out from Peel to all over the province of Ontario. So what we really need to do is we really need everyone to play along as much as possible, irrespective of the enforcement powers that might exist, to really try to reduce contact, interactions, and transmission and get us out of this third wave.
Now, you did tell us that you are able to take this decision without the province giving you the permission to do so. They already, in effect, do with the law. But now we have to find out whether or not you heard from the province after the fact. Did anybody from the Premier's office, any of your local MPPs, anybody from the Provincial Ministry of Health contact you afterwards and say, hey, Dr. Lowe, what are you doing? We didn't order this. You ordered this. What are you doing?
Well, I did have an opportunity to speak with Dr. Williams before it was enacted, and I remember on Monday evening I had a nice conversation with him. I think he understands the situation that we have in Peel, and I think to the degree that the provincial government and all of us at Peel Public Health share the same goal, which is really keeping our population safe, trying to protect lives, and trying to get out of this pandemic, especially with our vaccine coverage starting to really take off in the province of Ontario. I think he understands the unique situation that we have here in Peel and was basically saying, yeah, I support you taking the action you need to take, and was very keen to see what would be the outcome of this policy being enacted in Peel and Toronto.
I'm just confirming this, okay? Because you'll forgive me. I'm a little curious about this. You said you had a nice conversation with Dr. Williams. Genuinely?
Yeah. Oh, absolutely. Leaving aside the fact that I actually used to work in his office back in 2016, Dr. Williams and I have a very friendly and professional relationship. I think he fully understands that all of us as local medical officers of health, this is essentially part of the strength of Ontario's local public health system. You have physicians who are trained in public health, who are meant to understand their community, to see the disease transmission patterns in the community, and understand that what may be working in Temiskaming or Thunder Bay may not be what is working in places like Peel or in Ottawa. So I think he understands that we're acting in the best interests of our community, and I understand, of course, that when Dr. Williams is working on policy and approach, he's really taking into account the diverse nature of Ontario and trying to come up with something that works for all of us as well.
And Mayor Bonnie Crombie of Mississauga, Mayor Patrick Brown of Brampton. I mean, I think they represent, what's that, about 1.2, 1.3 million people there. They were on side with this as well.
I had the opportunity, of course, to advise them late in the evening as well of our intent to move forward with Section 22, and I think both our mayors have been very supportive. I think throughout this pandemic, I would say our mayors and council as a whole have really recognized the significant challenge that we face in the region of Peel. Our rates have always been the highest in Ontario. There's always been significant transmission in workers and individuals and residents being sickened in our region because many of the shutdown and lockdown provisions within the provincial framework leave open a significant proportion of our workplaces. And because of our employment profile, those are the people that are essentially bearing a disproportionate risk to their health in the course of their work to really keep the rest of us home and the rest of us safe.
Dr. Lowe, I don't have to tell you that when critics observe what's going on, the two questions they tend to ask are, why don't you do this? And then if the this is done, they say, why didn't you do it sooner? So let's go there. If this was apparently necessary, why didn't it happen sooner?
Yeah, because I think there's a few things that happen, Stephen, and it's a good question. A lot of people say, "Well, why now? Why this measure with workplaces now, knowing that we've had an essential worker challenge in Peel?" It really is because the variants have changed the game, and what we were finding, especially as this third wave started to take off in the last few weeks, is we were seeing more and more workplaces in outbreak. And of the workplaces that were in outbreak, we were seeing that transmission had gone faster and further. More people sickened more quickly. And so for that reason, we said, okay, this is a whole different game than the wild type coronavirus that we saw in the first two waves, where you could keep places open and avoid disruptions by dogged case and contact management and outbreak investigation to really contain it within the workplace. We were finding that by the time our investigators were getting into some of these situations, the disease had spread so far beyond any opportunity to control transmission. So, in the interest of protecting workers in our community, we realized that the calculus had flipped from let's try to let's try to minimize disruption and contain things with the outbreak to we need to treat workplaces to some degree like schools, and that's the measure we've taken in schools. You detect a couple cases in a classroom, you send the whole classroom home. We essentially said, yeah, I mean, this is what we need to be doing in workplaces if we want to get ahead of this thing.
And let me just confirm that I understand what these new Section 22 orders allow you to do. This allows you to close businesses for 10 days if those businesses have 5 outbreaks within 14 days. Have I got that right?
It's 5 cases within 14 days, Steve, and it would essentially be cases in the commonly understood definition of an outbreak being reasonably acquired in the workplace, or for which that cluster of cases has no alternative hypothesis outside of the workplace itself. And really, this expedited closure is about saying, all right, 5 is the threshold that we've seen, where there may be more, and there may be more transmission that is occurring at that moment that requires you to basically break those chains of transmission and then have your investigators be able to determine things. Now, of course, if we determine that there isn't transmission occurring, if we close and we identify through a rapid investigation that things seem to be all right, then it may be less than 10 days. But the reality is that we've seen too often on the other side where we haven't had the chance to really get ahead of this, and then we're seeing many more workers sickened and going to hospital, which is really really significant.
Right. Cases, of course, as opposed to outbreaks. Much better word to use. Thank you. I'm not sure this is under your pay grade, but I'll ask anyway. If the businesses are closed for a 10-day period of time, presumably, obviously, everybody gets sent home. Do you know whether or not there's a provision in law or otherwise for the workers who are being sent home for those 10 days to be paid, or are they without pay for that 10-day period?
So that's a really great question, Steve. And we all know that paid sick days save lives and they really prevent spread and transmission. I think the data is very clear on that. We've been calling for paid sick leave for quite some time because we know in the region of Peel that 1 in 4 of our workers has gone to work sick. We did an analysis of 8,000 cases in the early part of this year that actually demonstrated that the date of symptom onset and then the date that people were reporting when they stopped working, sometimes that second date was coming after the date of symptom onset, showing that they had gone to work sick. And I think to the extent that we have engaged businesses throughout this pandemic, there have been voluntary closures up till now, and we also had certain closures that were directed with various employers. I have seen that employers have been willing to be good corporate citizens, have been willing to take care of their workers and make sure that the leave is paid. Certainly, as we are trying to bring this third wave under control, I would hope that that sort of goodwill will continue. But you're absolutely right, Steve, that there is no legal mandate at this point in time. And also, that's, as I understand it from our legal counsel, that's not what we can use a Section 22 power for. That again is it's not necessarily, it would not necessarily be defined as a immediate control of communicable disease piece. Although arguably, I guess you could argue it one way or the other, but it's just our hope that our companies will continue to work with us, recognizing the gravity of the situation in our community right now.
And just so we understand what, in your view, a really good, effective paid sick day program would look like, and I think we got the first hints from the province a couple of days ago from the Minister of Health and the Minister of Labor that they're now prepared to entertain that idea. In your view, the employer pays the whole shot, the province kicks in some money as well, a hybrid of all of the above, or what does it look like to you?
So that's where it sort of breaks down for me because I'm not an expert in terms of social service funding, etc. I'm a scientist on the side that I can actually see the data of how it helps, and I think what I understand from the data, there's been many studies that have been done. They've compared U.S. states that had paid sick leave, U.S. states that didn't have paid sick leave in the midst of the COVID pandemic, and found that those that did have paid sick leave had less intense waves and less intense transmission. Similarly, there's been studies of long-term care homes in New York, those that have had paid sick leave versus those that didn't. Those long and we're talking about long-term care, which was really a flashpoint in the midst of our pandemic as well. There was clear evidence that in New York State, in one study, long-term care homes with paid sick leave had lower rates of gastrointestinal and respiratory outbreaks than those that didn't. So, I mean, to the extent that it needs to be accessible, it needs to be guaranteed, it needs to ensure that workers can do the right thing with confidence and stay home if they feel sick. It's less important for me who pays for it. I think it's more important that it is easily accessible and that it is communicated and that workers understand that they have that right and protection.
Gotcha. In our remaining moments, Dr. Lowe, let me check in your view, how the vaccine rollout is going in Peel Region so far. What can you report to us on that?
I would say the vaccine rollout is probably the one bright spot in our continued fight against COVID-19 in the midst of this third wave. We're now getting to a point where we're doing 12,500 doses a day across our system, across all channels, including our mass clinics, but also mobile and primary care. And I think we're continuing to move quickly down the age groups. So we already have 40%, over 40% of our 60 plus population covered. I'm confident that we're going to be able to meet Premier Ford's 40% of the community covered by the goal to have that done by May 5th. And so I'm really hopeful that if we could just reduce our contact and interactions, limit transmission, and bring this third wave under control, keep our healthcare system intact and save lives just for the next few weeks, then the vaccine coverage is ticking up at one point where hopefully the two lines will cross and we can really start to enter a different phase of the pandemic with transmission changing in our community.
We've had anywhere from 3,500 to more than 4,000 positive test cases across the province a day for about a week now. What do you think we can get to, and by what date?
Again, the Ontario Science Table has actually put out some really helpful projections, and I think to the extent that that's why we are focused on strengthening measures where we know transmissions occurring. The Ontario Science Table says that we can try to limit it at around 5,000 if we have strict measures over 6 weeks, plus continue to vaccinate 100,000 doses a day across the province. So for us at Peel Public Health, we're going to continue to do our part. We'll continue to do our 12,500 and hopefully ramp up more as supply improves and the volatility in the supply chain resolves. While we also really just try to ensure that strict measures keep our residents safe and reduce transmission.
Dr. Lowe, I've got one more question for you, which is you medical officers of health all over the province, but particularly in the hotspots like Peel Region, have been working really long hours for a very long time now. Should I infer that your gas tank is just about empty?
Well, Steve, I'm very well supported. I've got an excellent team at Peel Public Health. I've got a wife and children that that I'm working from home. I'm able to sort of offer respite and rejuvenation. Lots of friends and a council and community that I think really understand the gravity of the situation and have been very supportive. So the gas tank may be quite depleted, but it does get refilled with kindness and goodness, and that's really what's going to get us through this together. So I appreciate you asking the question, and I hope that everyone will continue to stay well, stay safe, and take care of each other as we get through the next few weeks.
Well, I think we could hear from the background noise that, yes, there are children in that home of yours right now, and we thank them for loaning you to us for the last 20 minutes, and we're grateful for your time on TVO tonight. Be well and stay safe.
Thanks for having me, Steve. I appreciate it.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.